Hi, my name is Greg Evans. I'm a practicing pediatric dentist in Fort Collins, Colorado. The question you asked is a good one, and unfortunately I not only answer questions about dental emergencies, but I treat them. Dental emergencies are always an emotional, upsetting time, both for parents and the patients, but taking a few systematic, objective steps is really going to help you get through and feel better for everybody. Step one is to stop the bleeding. We have to use a wet cloth or a gauze, even a piece of shirt, to stop the bleeding and to figure out where the bleeding is coming from. If it's coming from the soft tissue, is the cut deep enough to see fat or muscle tissue? If yes, get to a dentist for stitches. Generally speaking, tongues are not usually sutured unless a portion of the tongue is loose. If the lip is cut past its red border, you will need to find a plastic surgeon to do the stitches. Short of that, most dentists can stitch up soft tissue injuries. Step two, can you get your kid to close their jaws completely? The upper and lower jaws should move up and down, and you could fully seat the teeth comfortably when you ask the child to close. If there is a tooth that's broken and that interferes with that, that is going to need attention. Also, and maybe more importantly, if the jaw deviates from side to side as the child is closing, that may signify a jaw fracture or a condyle fracture, and that's going to need to be treated immediately, probably in a hospital setting. Step three, are any of the teeth dislocated, meaning are they pushed out of the arch? If we're talking about baby teeth and a baby tooth is pushed front or back, generally speaking, you'll need to talk with a dentist, and the dentist will need to take that baby tooth out. We do not put baby teeth back in or splint them back into the right spot because of the danger that may hurt the underlying permanent tooth in the jaw. If this is a permanent tooth, it's a completely different story. If a tooth is pushed back or forward, the bold parent should grab a hold of that tooth and push it back into the socket, oftentimes with an audible pop. Once that tooth is placed back in the socket, it has a chance to heal properly. But you'll need to contact the dentist relatively soon so they can glue in a little wire or put a little brace on that tooth to stabilize it for probably about 1 to 2 weeks. In some cases, where the blood supply has been lost to the tooth and where there's a bone fracture, you'll need to visit an endodontist for root canal treatment in order to save the tooth, and the splint will need to stay on longer in order to let the bone heal. Step four, are the teeth chipped? If a tooth is chipped, it can either be mildly sensitive or it can have excruciating pain for a kid. If the tooth is cracked into the body of the tooth or the dentin of the tooth, a child can suck in or out air, or when they drink cold water, it'll be very painful. In that case, a dentist will need to be contacted, and a thin layer of composite or a filling material will have to put over that dentin in order to try to minimize the pain to that tooth that could result in the death of the tooth. If the tooth is fractured into the root space or into the nerve space of that tooth, an immediate procedure called a shallow pulpectomy or a sphencpulpectomy will have to be performed in order to try to prevent the tooth from becoming infected and having to do a full root canal. Again, time is of the essence, and about within 2 hours of the tooth being chipped, you need to be seen by a dentist. Step five, finally, is the tooth knocked out? Again, with a baby tooth, if the tooth comes out, the crisis is over. The gum will heal slowly over time. The child should be given Tylenol and encouraged that the tooth fairy is coming. If this is a permanent tooth, a completely different story. A child who loses a permanent tooth will not grow properly without that tooth, and over time there will be a loss of bone in that area, which will cause a very large aesthetic defect. The tooth needs to be placed immediately back in the socket without washing the tooth out. The typical scenario is the child slides into home base, the tooth is knocked out, it lays around in the dirt. Someone needs to pick that tooth up and put it right back up into the bloody socket. The blood of the socket is what's going to nourish the cells holding the tooth into place, or the ligament cells. If those cells are damaged, the tooth will never go back. That has got to be an immediate action. And then you need, again, get to the dentist within 2 hours to have that tooth splinted back together. In some cases, parents have learned to put avulsed tooth into cold milk. This is a very distant second to putting it back in the socket, and every effort should be made to put the tooth back in the socket and hold it there with a wet cloth until first aid treatment can be done. By necessity, after that tooth has been splinted and it reattaches with the ligament, a root canal will have to be done in order to save the tooth. It is estimated that tooth loss would cost a person between $15,000 and $20,000 over their lifetime to replace and care for a fake tooth in that area. Time is essential in this regard. That's a quick rundown of what to do when. If you are a school or an organization, it is an excellent idea to have a plan in place for dental emergencies and have a dentist on call. If you're a family, it is always great to have a family dentist or a medical home for your child, so someone you can call. It's never a good idea to go to the emergency room for dental emergencies. They don't have dentists on staff. For more questions about this or for greater detail, please visit my website at www.biggrinswithdrgreg.com or simply email me. I love what I do and I want to help you raise healthy, happy children. Thanks for tuning in.